Mr. Lambert? Ms. Mendoza-Locke? Mr. Ortley? Ms. Rodriguez? Mr. Salas? Did you call Crockett? I did. I'm here. I wrote you as here. Okay. Do you recognize our visitors, please? Let's move on to our oath of office for our new board members.
You want to come up here, do our oath of office for our new appointed trustee, Mr. Herb Ortley. Herb, you want to stand up? Every time I come here, I say the same thing, but it's all stuff. But I just want to thank you folks for serving on this board. It's such an important board for our community, and you do good work. Thank you, thank you, thank you.
And I've done this a few times now.
Yes, you have.
I'm currently just starting my 40th year as a judge, so I guess I've done a few of these. Having known Linda for so long, she can't believe that, but that's the story.
Oh, no, that's IC5.
I, Herbert Ortley, do solemnly swear I will faithfully support the Constitution of the United States,
Constitution of the United States.
Constitution of the State of Ohio,
Constitution of the State.
Thank you, sir. Thank you.
Herb, you want to take a few moments to introduce yourself to the group? Sure. Good afternoon, everybody.
Originally from the mountains of western Montana, joined the Coast Guard in 1985. 29 years active in the Coast Guard, ended up in Toledo for the last tour. Retired, and the Coast Guard hired me back full time. I've been working with now for 26 years. I've had some experience with both accessing mental health and supporting others with mental health issues. One thing I'm kind of proud of doing is being a applied suicide intervention support technique trainer for nurse. Did that for a few years, doing nurse support units, and helping others, help others deal with stress and suicidal ideations. And I love to volunteer, and I'm really looking forward to working with you all. So, thank you.
Thank you.
If we could go just around the table and introduce yourself, and if you're a trustee or board staff.
David Arnold, trustee.
Wendy from Lester, staff. Trisha White, trustee.
Scott Simon.
Bryce Gordon, trustee.
Felisa Crockett, trustee. Mima Bell, trustee. So moving on, we're on number 5 of the agenda, the Planning and Oversight Committee meeting minutes from November 4th, 2025. Please hopefully have a chance to look those over. Is there a motion? Second. Is there any discussion? All those in favor signify by aye.
Aye.
All those opposed? Motion carries. Moving on to number 6, the treasurer's report from October and November fiscal year 26, the financial statements. Amy?
Good afternoon. I'm going to start on page 7 with in November, we saw a decrease in net assets. The third line was a minor grant payments for fiscal 2026. In addition, $49,000 was released from the assistance grants distributed early in the month. Year-to-date net assets show positive increase of $4.53 million, which is $0.84 million favorable compared to year-to-date budget. Total year-to-date revenue is favorable to budget by 104%. This variance is largely related to the timing of actual receipts compared to the revenue expected. Federal revenue is currently below budget due to the timing of receipt of SAS 4.0 Year 2 funds and flood recovery housing funds. The grants for those funds have been submitted, but we haven't received them as of November. On the expenditure side, November spending is typical and remains under budget across most categories, with year-to-date expenditures at 84% of budget. The largest variance is within purchasing services, where increased payment activity can be expected in December. Year-to-date grant-funded program expenses are under budget by $437,000, as some program invoices are not received processed until December. On page 6 is the balance sheet. And you'll see that's decreased by about $3.2 million. Accounts receivable and accounts payable decreased as year-end accruals were processed in November. Deferred revenue decreased as revenue was recognized for grant expenses incurred in November. And the non-designated fund balance decreased by $3.26 million, with a total balance at the end of November of $19.02 million. Payment details can be found on pages 8 through 10, and there is a motion for consideration at the bottom of page 5.
So there's a motion at the bottom of page 5 regarding approval of the November 25 financial statements and the November 25 voucher schedule of bills as presented in the January 2026 board meeting packet. Thank you. There's a motion and a second. Any discussion?
All those in favor signify by aye. Aye. All those opposed? Motion carries.
Okay, hello, everybody. Welcome back. I'm going to draw your attention to page 11, Lucas County Guardianship Services.
State fiscal year 2026 second half allocation. As you are aware, we are in a partnership with probate court and the Lucas County Board of Developmental Disabilities to fund the Lucas County Guardianship Services. This board was heavily invested in the development of that board after we identified a need for professional guardianship services beyond that of what the current existing attorneys would provide. Care coordination and case management services in particular. A more personalized approach to serving some of the individuals in our community who had little to no access to guardianship services due to capacity needs. The program is going quite well. The board is going quite well. I'll also mention that, you appointed Tim Goyer to that board, a previous employee here, at our last, I think the last time we talked about this. He's doing quite well at that board as well, but nonetheless. Guardianship Services Board operates on a calendar year contract. We fund on a state fiscal year basis. So each year, we fund from, out of our board allocation plan that we approved in May, half of their allocation for the existing contract period for the Guardianship Services Board. And then in January, I don't have authorization to enter into a new contract. And so we seek authorization to enter into a new contract and then allocate what is our second half amount for state fiscal year 26. So we give a total amount of $335,000. We've already allocated half of that amount during our annual purchasing process back in May. And what this motion does is authorizes us to enter into a new contract with the Guardianship Services Board for a total allocation of $335,000, but we're only allocating $167,500 of that amount at this point in time. And there is a motion to that effect at the top of page 11.
Motion, is there a second? Second. All those in favor I'm sorry, any discussion? All those in favor signify by aye.
Aye.
All opposed? Motion carries. Michael, you have number 8.
Thank you. On page 11, under Guardianship Board, we have the City of Toledo ARPA funds allocation. Back in May, we came before you to ask for an allocation for 4 distinct areas. And that allocation essentially ran through December 31st, 2025. What we want to make sure is that these organizations and these initiatives had ample time to be executed and funds spent correctly. So we're coming back now with a motion asking that we can extend this to June 30th, 2026, which is in alignment with the agreement we have with the city of Toledo. So there's a motion there to be approved that these funds be allocated until July 30th, 2026.
July 30 or is it June 30?
I mean, June 30th. I said July 30th. June 30th. That's what I thought.
Okay. So there's a motion near the bottom of page 11. There's a motion, is there a second? Second. Any discussion? All those in favor signify by aye.
Aye.
All those opposed? Motion carries. Health Officer designation, Elijah?
All right, so at the bottom of page 11, you'll see the beginning of the health officer. Our advisory group had interviewed 7 new applicants. You'll see them under new designations and then two of those. So the motion is near the top of page 12, and then just for your information, the current demographics incorporates the ones
Okay. There's a motion at near the top of page 12. Is there a motion?
So moved.
Is there a second? Any discussion?
No, I'm just pleased to hear that there's 3 new African American, and that's positive for us as, minorities. Thank you.
Yeah, how hard was that?
Practice makes perfect.
And for the record, let's make sure it's percentage, increased percentage, not 3 new, increased percentage.
Which is.
Actually 3. Because there's about 100.
Right. All right. All those in favor signify by aye.
Aye.
All those opposed? Motion carries.
Thanks for your honesty.
Moving on to number 10, Scott.
Okay, you may have noticed that, we're trying to keep the agenda somewhat quick so that we can get to the discussion around strategic planning. So don't be alarmed by some of the housekeeping things that we're doing, today. We kept some of the other stuff off this agenda. But, this is one of those housekeeping items that, we needed to clean up. So, each year in May or June, in our regular allocation plan, we request funds for Lucas County Family and Child First Council. Pooled funds is a group of boards and others, juvenile court to JFS, ourselves, DD, CSB. We put money into a fund for multi-system youth. For services that are not Medicaid reimbursable or reimbursable through other types of financial models. We rarely know the actual amount that we will actually need prior to the time we will request those funds. We usually go off the previous year's amount. So that's what we did at this time. We requested allocation of 188, 750, which was granted. And then in August, we got an invoice that our amount was actually lower. It was $165,054. So it was lower than, about $23,000 lower than what was previously allocated. However, what we failed to do is also, in our May allocation, request funding to continue the parent advocacy and leadership program that we originally funded back in, I think it'd be probably May of '23, at an amount of around $22,000. Because of that awkward 15-month actually allocation, we simply missed it. But when we got the invoice, and we didn't get the invoice until this month or last month, we went, oh, we don't have an allocation for this. So what we're trying to do is clean up some of that work. The Parent Advocacy and Leadership Program is, well, we discussed it the last time. It's a rare program that we fund that directly impacts parents. We talk a lot about improving the lives of parents, supporting parents, and helping them learn new skills. This program is actually something that does that. It is three separate distinct models combined into one to create this overall program. The first, I guess, program is what we actually call the Parent Advocacy and Leadership Training, or PALT for short. It's 5 sessions over 5 weeks. They run a series of 3 cohorts, and you can read what they address in those cohorts. And they aim to serve 20 parents per session. And when you're dealing with parents and targeting parents, it's very helpful to support them by providing meals, transportation, childcare, and participation incentives. And this project does all of that for all 3 of these areas. The second area that this project does is what's called a parent cafe. And essentially it's parents getting together and having a conversation and doing self-reflection on what they've learned and what they're experiencing and how they might use some of their skills to support, promote their engagement in the community, but also to support their developing leadership skills. And then the final piece is this parent-to-parent support group where those folks get together, people who participated get together, and then they share their experiences and learn from each other and support from each other and develop community. We are one of several agencies that contribute to this program. It's only $15,000, and I'm still not giving it justice by talking this long about it because it is such a quality program. I've had the experience of not only visiting the program, but also being their commencement day speaker. And it is a transformative process for the people that go through it. So I would strongly encourage and recommend the two motions on the top of page 14, and happy to answer any questions that you may have.
Seems to be a great return on the funds that we set aside for that.
We'd be lucky to get that return on all of our investments, that's for sure.
Why don't we just allocate the 23,000 that's extra?
It's not the invoice. So we'd have to go back and get another invoice. And if you wanted to do that, that's fine. And we could always adjust the invoice.
We're listening to you tell us how great this is. I mean, let's give them what we could.
If you wanted to allocate the difference, I'm sure they would be happy to take it.
Guessing that they could use it.
They could. There's no doubt about it.
How do parents get involved?
There's flyers that get placed out. They do recruiting and word of mouth through programs, agency programs, things of that nature. Somebody doing the math while we're working on this so that we know how to change this motion. And then they have the Family and Children's First website that they go. It's run and coordinated by Melissa Clore out of Mercy Hospital right over here on Jefferson and 23rd Street. And so there's also a lot of in-kind that the Mercy system provides them a place to stay. Things like they had a place to do this, but the transportation relies on cab service. And the janitorial staff for that building had to leave at like 6 o'clock. So they ended up like kicking families out of the building while they're waiting on their, and so, you can't do that, right, in the winter. So Mercy stepped up, provided them a place to stay, operate out of. They have a facility that can, help with catering there, and just a nice meeting area for this group to have. So if you're interested in that number, the difference is, it's already there, 23,696. So if you were to just designate the entire amount, that 15,000 would turn into 23,696.
I need a motion.
You need to revise the first motion.
Motion.
Who was the first? Are you okay with that change? Second?
Second.
Who was the second? Are you okay with that change? Okay, so then you're okay.
Okay, so all those in favor of approving the motion as it has been revised to reflect the $23,696?
Both motions.
Okay,
Both motions.
both motions, including the change to the second motion.
Yeah.
All those in favor signify by aye.
Aye.
All those opposed?
Thank you. They'll be thrilled. Perhaps we could get some more robust data for you, or maybe even a testimonial from somebody that went through. Yeah.
It's a frequent referral from my CASA kids. Their parents go through this fairly often.
Okay.
Okay, so we're getting our electronics ready. To come back at the February piano meeting with the full draft document that includes summary of all the surveying and stakeholder feedback and all synopsis of the work that was completed, then the goals, statements, and then the work plans for your consideration. At that meeting, you'll have another opportunity to provide any additional feedback. If there are changes, we'll present the final doc at the February 17th trustee meeting for discussion and approval. If there are no changes to the February 3rd meeting doc, then it'll stay on the consent agenda and we'll just get approved at the February 17th meeting as a consent agenda item. As I state that, I am putting you on notice now that February's Planning and Oversight Committee meeting is shaping up to be a long one. As we not only have strategic plan to go through, but we also have the discussion of the 120-day notice that we have to do every February in preparation for March 1st approval. So I would expect a meeting from 4 to 6 p.m. On February 3rd for sure. So to move things along right now, we have folks from Health Management Associates, Lauren and Katie joining us here today, and it looks like they have some support staff in the background as well. I can't read that far, so I'm not sure who's there.
It's us, it's us.
Oh, that's us.
So, okay, so they're double wall.
But we're gonna turn it over to them to lead us through the rest of this process. This is an interactive process, so this is the time to ask your questions or provide your input. Lauren, can you take it away?
Yeah, absolutely. Let me go ahead and set things up here and share my screen. Okay, sharing screen. Okay, can you see that?
Yes.
Okay, great. Thank you, everyone. Thank you, members of the piano committee. I'm Lauren Anthus. I'm principal here with Health Management Associates. I'm joined by my colleague, Katie Stevenson. I know we have met with many of you during the retreat, and thank you for creating the time today. We'll walk through where we are at as well as what our next steps may be. Because we are virtual here, if you have any questions along the way, please just feel free to ping us and let us know. And then we'll be sure to answer any of those questions that you may have. Okay, so what I want to review with you all today are the SMARTY goals that were developed through the month of December after the retreat. These are essentially as close to final versions of what would comprise a strategic plan. The strategic plan document will have a number of items in it, including introduction, executive summary, information on the assessment and the related data that we conducted with the focus group information, as well as survey, a finalized version of these goals, as well as what's known as RACI matrices. RACI matrices help assign accountability, so that it's a way to organizationally tie in what's being outlined through this goal process to core functional parts of the organization, as well as who's responsible for what. It's not only a matter of establishing the plan, but also who's going to carry out the plan. And a lot of this too, as you will see, is going to reflect some of the feedback we received during the retreat, which included the need for more specificity and more measurability, as well as the ability to be concise. I'll walk through what SMARTY goals are, how they get defined, what the process looks like, and also what you're going to see here is a representation of longer form documents that represent what those SMARTY goals entail. We have those longer form documents available, but it's a bit unwieldy to try to distribute all these and go line item by line item, but you'll see a good representation. And our goal here today is get feedback from all of you from each of these goal areas to derive, hey, is this on point? Are there any pieces here that you feel maybe could be augmented, or is there additional feedback you would have because we have some additional staff engagement to conduct later this week. So first of all, SMARTY goals are used to translate strategic priorities into clear, actionable outcomes that can be owned, implemented, and reported on. So a big part of this is about creating transparency for all of you and the board generally, and the public, so that you have an understanding of, hey, what it is that we're trying to do, how does this meet the mandates set forth in regulation, and how do we hold ourselves accountable to hitting certain standards and benchmarks, particularly at a time when funding is a little bit precarious and the landscape is changing quickly. So SMARTY stands for, you may be familiar with SMART goals, but adds an element of inclusivity and equity. So considers who benefits or who may be left out. And that's a very broad idea. We can think about that in terms of diagnosis. We can think about that in terms of geography. It might even be, who may not be receiving a certain type of service. So the idea is, how do you ensure that access and notions of access are a part of that? And you'll see the equity in action work is being translated into an accessibility framework that's sort of baked throughout this process, something that also came out through the retreat. So to revisit this, just to make sure we're clear, specific clearly defines what will change and for whom. Measurable identifies how progress and success will be assessed. Achievable reflects a realistic capacity, authority, and resources. Relevant aligns with the board's priorities and role. Time-bound establishes a clear time frame for completion within the strategic plan. And then again, inclusive and equitable considers who benefits or who may be left out. What's important to highlight here is that these are not activity lists. These are not work plans. This is not about having individual staff people identify all the things that we're going to do for the next several years. These are meant to be anchors related to outcomes that help us establish who is accountable and then create the opportunity for reporting and strategic thinking at not only a staff level, but a board level as well. Any questions so far about SMARTY goals? Good. Okay. So, the idea here is that these are a bridge between strategy and execution, right? This is a strategic plan. This is not a tactical plan. So what we're doing as a part of our engagement with the board is developing these SMARTY goals to define clear time-bound outcomes. Then, as an add-on to that, and what will be the focus of our staff workshop on the 8th, is to develop RACI diagrams, which assign ownership and accountability. RACI, if you're familiar, stands for responsible, accountable, consulted and informed. It basically gives like a roadmap at a staff level of, hey, who is really taking ownership over this issue, making sure that you're hitting the benchmarks that you need to. From there, you develop work plans, dashboards, and other sort of board reporting tools that focus on outcomes, trends, decisions, maybe help identify where you might need to have some tweaks or be responsive in a different way. Like we talked about, the landscape is shifting, so having these tools at your disposal helps you understand in what ways is that landscape changing, and that enables you all as a board to be strategic and responsive. So this helps us keep strategy from stalling at the planning stage, which often happens. It ensures accountability at every stage, and it supports consistent outcome-focused board oversight. So the idea here is that these enable execution and meaningful reporting across the entire effort. I'd also want to highlight this particular type of process that, based off of our response to the RFP, was intended to be participatory on a very tight timeline. So what that means is, as opposed to us doing an assessment, maybe interviewing all of you, we really try to center as much as possible the voices of staff, the voices of the board, the voices of the community in establishing these goals to drive the strategy. So that participatory part of it happening over the last several weeks has been the primary focus and will be the thing that results in the final product that comprises the strategic plan. So talking about the goal development, right, we sort of highlighted this, but I want to talk about our process so far. We went through that assessment process. So we went through the system assessment, we reviewed documents, did the stakeholder input, had the retreat, included staff, board, and community perspectives and all of that. Then we engaged in a process of staff drafting that comprised the first workshop, which also took place during the retreat itself. Then we as HMA reviewed those goals for clarity, feasibility, measurability, consistency. Hey, in what ways are these aligning with what we had expected of SMARTY goals? We provided that commentary. Then we opened it up for board feedback. So board members all had the opportunity to weigh in on what the staff had drafted directly in those documents. And then what we did is try to resolve those as much as possible. And then what today represents is an additional opportunity for other feedback. So yesterday we sat down with the staff, reviewed the goals, talked about what some additional tweaks may be, made some amendments to some of those drafts, reflecting our comments, your comments, and their thoughts, so that we come to a more finalized version. There's probably a few tweaks that we would probably want to make specifically around measurement, but for the most part, when you evaluate how developed these are and how consistent and high fidelity they are relative to the practice of establishing these goals, they were pretty consistently high quality. So, the focus of all this is really getting into what will change and how will progress be understood. And the point of this type of strategy work is to avoid overly prescriptive tactics. You don't want to impose work plans and say you should do these following activities. It's really about highlighting, here's what you need to engineer towards. And so that's the focus of these types of goal development. Okay, so now we're going to go into a goal review. This is a roll-up summary of all of the goals. So there is going to be subsequent slides that we will go through in each of the 5 areas. And what you will see here is the goal, the primary outcome, the impact that's estimated, as well as the timeline horizon, generally for the goal that was highlighted. So the first one, 1.1, is around communication, transparency, and stigma reduction. The second is around priority services and populations, as well as behavioral health benefit package definition. The third is around crisis. The fourth is around technology, data management, and decision support is how we're framing that. The fifth is around communications and community engagement. So that includes awareness, trust, and navigation, organizational and community responsiveness, and then the community accessibility plan, which serves as an evolution of the equity and action plan. So this just gives you a high-level look across the board of those outcomes, as well as the impact that's being sought. So what we'd like to do now is go goal by goal and see if you have any thoughts, questions, or other comments that we could then take as feedback back to the staff to further refine and then finalize as the piece that would eventually be adopted by you all as the board. Okay, so the first group is focused in on organizational development, and and they had a single SMARTY goal 1.1. Overall, what this goal represents is the desire to increase and improve communication, transparency, and stigma reduction. What you'll see, by the way, as we review these goals is a consistent format. Like I said before, there's deeper information available, but the format will include for each goal 2 slides. The first slide will include a plain language objective. What is it that we're trying to achieve? And then a goal statement, something that summarizes the totality of the goal that's being sought. And then there's a grid, which you will see here soon, around what the SMARTY represents in terms of specifics, measurability, so on and so forth. So you'll see that consistent approach from how we structurally represent this. So in 1.1, around improving communication, transparency, and stigma reduction, the objective is to improve how the board communicates internally with trustees and with the community. So agency priorities, use of public funds, funded services, governance, and real-world impact are clearly understood. The SMARTY goal statement is that within 18 months, the board of Lucas County will strengthen communication, transparency, and stigma reduction by implementing standardized monthly departmental activity summaries that integrate key financial information, aggregating those summaries into consistent trustee reports, and producing accessible public-facing communications. These efforts will improve trustee understanding of agency performance and the use of public funds, increase public awareness of funded services, and intentionally elevate diverse community voices, including individuals with lived experience, while leveraging existing workflows to avoid unnecessary administrative burden. What this looks like in terms of the SMARTY goal specifically, you have the specific standardized departmental summaries, aggregated trustee reports, public-facing communications, including impact stories, spotlights, and stigma reduction messaging. How this will be measured, 85% departmental compliance by Q3 of fiscal year 26, 10 trustee reports per year, 80% trustee understanding by fiscal year 2026, 36 public communications annually, and a 10% engagement and growth across media platforms. And then there's different ways that that would be measured. That's getting into the more detailed version of this. Achievable, there's going to be some existing reporting processes, financial data communication platforms, and relationships. There's no new staffing or technology required, so that makes it a lower hanging fruit. It's just about organizing oneself and managing towards it. Relevancy, it strengthens fiduciary oversight, transparency, accountability, informed governance, and stigma reduction. Time-bound, templates for this reporting will be finalized within 3 months of execution, reporting implemented within 6, stigma campaign launched within 12, and the measure stabilized within those 18 months. And the way that this becomes the SMARTY goal is that the communications will internally reflect diverse providers, trustees, and individuals with lived experience to expand reach and representation countywide. So that comprises SMARTY goal 1.1. I want to take a moment here, see if there are any specific questions about 1.1. If not, I can move on.
Let's move on.
Group 2, focused on population support. There are 2 goals within Group 2's work. The first around establish and align priority behavioral health services and priority populations. The plain language objective, clarify and formalize the board's priority behavioral health services and priority populations to guide funding, oversight, and system development decisions across Lucas County. The goal statement, by November 30th, 2026, the board of Lucas County will establish and adopt a defined set of priority behavioral health services and priority populations grounded in data, community need, and statutory responsibility. By February 1st, 2027, the board will complete a review and ranking of all currently funded programs based on alignment with those priorities, and will use the adopted framework to inform fiscal year 2028 funding, contracting, and oversight decisions. The SMARTY framework, board adopted priority services and populations guide funding and contract oversight decisions. So that's what we're trying to do. Measurability, consultant would be engaged by June 30th of 2026. I know that there were some questions from the board in the development of this process. I would just want to highlight that's probably getting more into the tactical aspects of how you execute some of the staff discussion. Just by way of example was that an RFP that would be issued for the consultant should include specifics around what's being asked of them, why that's being asked of them, how that relates to regulatory and statutory responsibility. et cetera, but that's much more of a board discussion on a tactical level, an implementation level. Framework would be adopted by November 30th of 26, program ranking completed by February 1st of 27, and then decisions would be aligned by fiscal year 28. This is achievable because it's supported by statutory authority. That's very important. And existing data that's available, community engagement processes, and contracting processes. Why it's relevant? It focuses the resources, strengthens accountability, and reinforces board system leadership role, particularly at a time where resources are more constrained or there might be more disruption in the system. How this is time bound is that the framework is adopted by the end of November 26th this year. I keep forgetting that it's 2026. And then alignment review by February 1st of 27 applied in fiscal year 28. Part of why this is a SMART goal is that it uses demographic, geographic utilization and outcome data with stakeholder input and is aligned with the community accessibility plan. So again, the evolution of that equity and action plan being focused in around the issue of accessibility. Okay, so for goal 2.1, any feedback, questions, or thoughts? If not, we will keep going. Okay, goal 2.2, establish and adopt a behavioral health benefit package with a pre-authorization process. So the objective here, design and implement a standardized behavioral health benefit package for Lucas County residents who qualify for board-funded treatment services. The goal statement, by January 1st, 2028, the Mental Health and Recovery Services Board of Lucas County will implement a standardized behavioral health benefit package and pre-authorization process across all contracted treatment providers to ensure continued access to medically necessary treatment services for eligible residents. Under the SMARTY framework, the specific, it's defined covered services and limits with a pre-authorization process embedded in board contracts. Part of how this will get deployed, medical director hired by July 1st of 26, Smart Care updates by September 1st of 26, benefit defined by January 1st of 27, pilot by July 1st of 27, and full implementation by January 1st of 28. With board purchasing authority, this is achievable, as well as there's a dependency or a risk associated with making sure that clinical leadership is in place, which is why the medical director is a key measurable as a binary, did it happen or not. Where this is relevant is it supports access amid rising costs and coverage loss risk, as well as strengthens the stewardship of the board. Phased milestones between 26 and 28, and where this is inclusive and equitable, supports uninsured and underinsured residents aligned with the community accessibility plan. So, I want to take a moment there. Any thoughts, feedback, or questions on goal 2.2? Okay, hearing none. Moving on, group 3, crisis. So, crisis service support is the focus for this particular goal. The objective here is to ensure board-funded crisis services provide timely, coordinated access to crisis response for Lucas County residents. The goal statement is by the next crisis service contract cycle, the board will align board-funded crisis services with state mobile crisis response requirements and 988 coordination protocols to support timely, coordinated crisis response for individuals experiencing behavioral health crises. Obviously, this is one of the mandates that comes down from the state. There's a lot in flux here. So part of this is about being flexible, which you'll see represented in the framework. So specifically, board-funded crisis services are aligned with those standards and coordinated with the 988 call handling, dispatch, and handoff protocols. Ways this can be measurable is the inclusion of alignment requirements in all crisis contracts. So the idea here is that whatever the standards might be developed by the state, that those get reflected in the contracts where appropriate. There's also going to be annual verification of provider compliance, a development of an outreach and feedback plan tied to the community accessibility plan. That's a typo there, to gauge system performance. So this actually came out of staff discussions for folks focusing on crisis. The idea that we need a conduit or a mechanism for stakeholders, whether it's in law enforcement or providers or individuals with lived experience, to weigh in on how crisis is performing so that we can make tweaks along the way. So the idea is that one of the measurables would be to develop an outreach and feedback plan to be implemented. Why this is achievable? This can happen through existing contracting, funding, and monitoring authority, and is supported by state guidance. This is relevant because it's a core statutory responsibility and a high priority access point within the local behavioral health system. It's time-bound because the alignment is incorporated by the next crisis service contract cycle with compliance verified annually. And the idea here is that it would improve crisis access across geography, time of day, service settings with stakeholder feedback used to identify gaps or disparities in response. So with that, see if there's any questions, thoughts, or feedback on goal 3.1. Okay, moving on, getting into group 4 for technology. The idea here in 4.1 is improve data management practices to support informed decision making. The plain language objective here is to improve the board's ability to make timely, informed, and equitable decisions by ensuring reliable, standardized, and decision-ready data across board-funded programs. The goal statement here is that over 3 years, the Board of Lucas County will strengthen its decision-making capacity by ensuring reliable, standardized access to clinical service utilization and operational data across board-funded programs, enabling consistent monitoring of system performance, service access, and disparities through existing technology platforms. This was an area of a lot of conversation because there's a lot of activity taking place on the infrastructure side of the board. And so the question is, what is that doing for us? How does that help inform things? So what you'll see here by these statements is the idea that this rolls up as an enabling infrastructure for all the important decisions that you have to make throughout this next strategic plan cycle. So you can see here, Smart Care, for example, supports billing claims and service level data. Cratio supports board operations, contract management, monitoring, and governance. And the ITP Phase 3 project assesses data assets and future needs. How this is measurable, there'll be an identification of priority programs and data elements. There's going to be availability of at least one standardized board-facing report to highlight the deployment of all of this. There's also going to be reduced manual reporting, completion of the ITP Phase 3 with findings presented to the board. So part of this is, how does this help us become more efficient and more responsive to community need? Why this is achievable is built on funded technology platforms and a phased implementation approach that prioritizes high impact data needs without overextending staff and providers. So this is a thought process that folks feel like they can follow through on. And why it's relevant is that reliable standardized data supports effective oversight, transparency, and decision making across all board priorities. So a lot of the resources that become available through this deployment help you all make good decisions and can help inform how reporting and decision making is data informed. The priority data is going to be identified within 12 months. The standardized reporting will be piloted within 24 months, and Phase 3 should be completed within 36 months. So what this does in terms of inclusion and equity, improved data enables examination of access, utilization, and outcomes by population, geography, and service type to help identify disparities. I can say this just as a consultant who's worked in this space, but also someone who's worked in providers, on boards with behavioral health as a part of philanthropy. Data is everything. And right now you need to be able to measure what you are doing, because what you can measure helps inform what you can do or what you can't do or what you need to do. So having these systems in place can allow you to be more strategic, quite frankly, in how you make decisions. Any questions, thoughts, or feedback on goal 4.1? Okay. Moving on to group 5. One thing I'll highlight about group 5, when we got together with staff, we had a lot of conversation up until group 5. So we're going to have a sub-final session with this group just to further refine some of the measures and the timelines around this, and that's happening tomorrow. But what you'll see will probably just be slightly augmented with a little bit more specifics, because we wanted to make sure that there was more time, especially because there are sort of 3 goals within the communications and community engagement work. Getting into goal 5.1, this is about increasing awareness, strengthening trust, and improving how individuals, families, and institutions connect to mental health resources and supports. So the plain language objective here, improve how Lucas County residents and community institutions understand, access, and navigate board-funded mental health and well-being resources so that individuals can connect to appropriate supports more quickly and consistently. The goal statement here is, over the strategic planning period, the board will strengthen community awareness, trust, and navigation of mental health and well-being resources by functioning as a clear and reliable point of connection for individuals, families, and institutions particular attention paid to communities facing the greatest barriers to care. So, what does this look like in terms of the framework? The board will serve as a central trusted point of connection for information and navigation across individuals, families, and institutions. How this will be measured is through engagement activity levels, things like how many events did we put on, who attended, how many people attended, where did we have these events, institutional partner use of board materials, as well as trends and inquiries or referrals to board-supported access points. So things like crisis, for example, might be a corollary to this, which is why part of this accessibility and communication work is baked throughout the strategic planning process. How this is achievable is that it builds on existing communication channels, partnerships, and peer infrastructure. Why it's relevant: helps with system clarity, supports earlier connection to care, and reinforces accountability for public investments. Progress will be demonstrated over the strategic planning period. There is intervals that were suggested that I think this is part of what we will refine. And then reach will be assessed by the engagement of communities facing the greatest barriers to care. So this is one of the reasons why the technology piece is so important, because knowing who is accessing and where can help inform how you might need to reach other people with other methods. One thing I'll highlight this particularly, this is a major theme that came out of our assessment, was that many people had information, but some of that information wasn't consistent, or they didn't know where to go, or it took a lot of peer-related information. So this is a good and accurate reflection of that need that was identified particularly by the community in our engagement. And so this is going to be important work that will serve as a follow-up to some of that community identified need. So before moving on to goal 5.2, I want to see if there's any questions, thoughts, or feedback.
How is this different from priority area 1?
So priority area 1, going back here. So this is primarily internally, but it also has some community sort of public-facing communication. So part of this is about, first of all, the stigma reduction plan is also about process and procedures of the board. It isn't necessarily tied into what resources are available to the community or how do we create the right sorts of handoffs. It's a little bit more operationally focused as opposed to, say, community engagement or public and institutionally focused. That's a good clarification. They definitely have a relationship. They most certainly have a relationship. I think you will see here and I don't want to get too far ahead of myself, but you'll see here in goal 5.3 when we talk about the community accessibility plan. The community accessibility plan is an evolution of the equity and action plan. And one of the things that came out of the retreat, as well as the staff engagement, was the idea that that needs to be threaded throughout each of these goal areas. So part of what you'll see with the community accessibility plan is it will be baked into all of the goals. I think one of the things that you'll see with goal 1.1 is that it will have even more pronounced sort of impact because it's so tied into communications as opposed to, say, technology, which might facilitate communications. Good questions, though. And we can make sure, too, we can have a discussion about maybe tweaking some of the language to make sure that there's some distinction.
David, was your comment based on should stigma reduction in 1.1 be moved to 5.1 or?
No, it was really more just, it seems like there's overlap, like we're repeating 1.1. I mean, it seems very similar to me, and we're going to have enough trouble getting our arms around all this stuff that we don't need to be having overlap or repeats.
I agree with that. I think I voted that or asked a question how it differed. It seems like they were inclusive subsets of only one were internal. And I agree, there's enough need here that we shouldn't be creating extra goals. That you might be putting as many of those or subsume by some things in another.
So Laura, let's make a comment to look at that on Thursday when we get back together?
Absolutely, absolutely. Yeah, I will highlight some of this just might be some tweaks. You know, I think the intent of 1.1 deals a lot with the operational activities of the board and making that information available not only to the board, but also to speak to what the responsibility as the organization might be, or 5.1 might be more along the lines of educating the community about resources generally and where to go for services. So I think we can add that as a note to our discussion on Thursday and come back with some strong recommendations and clarify.
That's a good, educate the community, but the board. So please talk about it. It just seems so overlapping.
Email to us so we can look through it.
The first one you had up there, it said 5.1, is that internal for the board and staff? And then the other one that said community engagement, is that what Mr. Carter does and other people like Robert, community engagement, when I see them out?
That's right. Yes. So
Was that the difference? Well, you could do that on most things that the board engages in.
Yeah.
Work internally and then work externally.
And I'll highlight too, just going into the 1.1 pieces, right? I would focus in on what's being measured in 1.1 versus what's being measured in 5.1. What's being measured in 1.1 deals with departmental summaries, trustee reports, public-facing communications regarding impact story spotlights and stigma reduction. So you have concrete internal activities dealing with processes, work plans, and workflows that are primarily internal and focusing on your management. 5.1, the main difference here and why it's useful to see these as sort of like legs of a stool. You can't separate communications as just an idea from what's being measured. What's being measured here is the community engagement activity levels. How many events, how many people attended, institutional partner use of things like flyers or messaging campaigns, or the app that was developed, trends in inquiries and referrals to board support and access points. So you see the differentiation mainly in what gets measured, because what gets measured has different workflow obligations. Does that make it clear? But we will discuss it and try to come up with maybe some differentiation that helps sort of build on that. Great. 5.2, organizational and community responsiveness. So the plain language objective here is to improve the consistency, clarity, and responsiveness of the board's internal decision-making. So organizational actions more effectively support access to behavioral health services across the county. Over the strategic planning period, the board will strengthen organizational responsiveness by improving the consistency and clarity of internal decision-making related to funding, contracting, access to services, ensuring staff actions are aligned with board priorities and community needs. So what this is, really focuses on a big conversation that took place during the retreat and with staff around how do we make decisions about this stuff internally as staff. So internal decision-making guidance development is really the focus here. And this gets into how do we improve what we do in terms of consistency and clarity of funding, contracting, and access-related decisions across departments. The measurability is, did we develop and adopt this guidance? Are there fewer decision reversals or escalations? And then internally, do staff report a better understanding of their roles when applying those board priorities? Why this is achievable? This is fully within the board's authority. It focuses on alignment internally and culture rather than new programs or staffing or explicitly things like communications with the community or the board. Why it's relevant, it helps support timely access to service, organizational stability, as well as confidence amongst providers and community partners because of that organizational stability. Again, improvements are expected over the planning period with early development of guidance. So the idea is that the guidance document would be developed early in the strategic planning process and then sustained application and measurement through things like surveys and engagement with staff over time. Decision outcomes would be reviewed to identify unintended differences in how access-related decisions affect populations or geographic areas. So if when this internal decision-making guidance comes out, when it comes to funding decisions or programmatic choices or recommendations, that guidance might get tweaked in the future if there's, some idea of like, hey, we're not applying this sort of decision-making criteria in a way that's consistent, whether that's within program areas or geographies or whatever those measures might be, which is part of why 4.1 is so important because it brings a relief map to understanding how that may work. Okay. So with that, questions, comments, or feedback on 5.2?
So it sounds like 5.2 is organizational development, which sounds like 1.1.
We're gonna talk about that.
We just had that conversation. But I will say, I think the key difference for 1.5.2 is that the intent when we wrote it was in regards to the equity and action plan. So the focus was, we're gonna create this plan, which is next, right? But this is why we're creating it. And this is what else is gonna do for us. So it was very connected to 5.3, that Scott said, may still be better in the 1.1, as long as we make the connection to the community accessibility plan and stating the definitions of why we're wanting community accessibility, how that ties in health equity, DEI, and all of those things, which may be some of the language that's missing that we'll fix in the morning.
And don't we want that?
Yeah.
Stated, the looking at areas can include accessibility and equity and availability.
Right, which is gonna be seen in 5.3. So there was sort of that.
That's right.
Communication plan, then we're gonna do the equity and action plan, and then 3 is, here's what we're gonna do for the equity and action plan. It's kind of like they're layered.
I will say to the members of the board, we had about an hour and a half to do the review, and quite frankly, like this is why we need to revisit things with group number 5, because your team is so engaged in this process. There was a lot of really good discussion, and then we had less time to basically get through some of these issues in group 5's work. But the thing that I would highlight as being the major throughput is that CAP, the Community Accessibility Plan, is baked throughout all of the goals. And you'll see in 5.3 a deeper articulation of what that entails. And it's really the thrust, I think, Michael, is fair, of what Group 5's work and focus is.
Probably goes 5.3.
Okay, let's get to 5.3. So 5.3, the Community Accessibility Plan. So the plain language objective is to strengthen how Lucas County residents understand, access, and experience mental health, addiction, and recovery services by developing a clear, board-adopted community accessibility plan. Within 1 year, the board of Lucas County will develop and adopt that plan that guides how the board communicates, engages, and supports access to mental health, addiction, and recovery services with particular attention paid to populations facing the greatest barriers to care. So this concept, as a part of the discussion we had, is baked in to all of the other goals. And so part of the responsibility when this gets developed is that it has to acknowledge how it does that. When we look into the framework here, so this is a board-adopted plan that establishes shared principles, language, and strategies to improve understanding, navigation, and access to services. The measurables here, completion of a draft plan, board adoption with 1 year, and documented use of the plan to inform access or engagement-related discussions or decisions. Why it's achievable is it builds on the existing planning processes, partnerships, and board authority without creating new mandates or reporting burdens. Provides a unifying framework that aligns communication and engagement and access efforts. So this gets into how this is intended 6 months and finalized within those 12 months. And the plan explicitly addresses barriers related to awareness, navigation, geography, language, and system complexity. So it really gets after some of those pieces that were highlighted during the assessments work. So any questions, thoughts, or feedback on 5.3? Okay. So with that, and I'll just go back to the sort of roll up. What we heard today really was about resolving some of the what's the differentiation in communication practices between what's in group 5 and what's in group 1. And I think we're going to work on that tomorrow, Michael, and then we're also going to bring that to the second workshop on the 8th. And some other things I just want to highlight here. When we looked at this relative to fidelity for these types of tools, it's very high. We have lots of good engagement. When we compare this to what was in the assessment, a lot of the assessment issues were actively addressed. When we think about what was at the retreat, we had basically a few planks of mandates from the board engagement that, number one, goals and strategy development needed to have more specificity. So there is stronger specificity here because there are specific concrete measures and timelines that are highlighted that will help operationalize this plan. And then we'll also tie in that RACI framework to develop the accountability process. And then secondarily, there was a desire to be focused, to be concise. So, even if we left things as is, we have 8 total items here. We may end up with less depending on how the conversation goes over the next couple of days, but it's a very doable sort of approach, and it's not a laundry list of things you got to do. It's really strategic and focused, outcome oriented. So, I think we have to congratulate the staff and the board members for their participation in all of this, because it's not easy to get to this level of detail, to dig into this level of fidelity in such a short period of time with a participatory process. But, I think we feel, especially having conducted these processes before with similarly situated organizations, this is a pretty strong approach and certainly meets the compliance requirements that and expectations that the state of Ohio has. So with that, I can stop sharing my screen or answer any additional questions that you may have. And Katie, feel free to weigh in if there's anything I may have missed.
Any comments, questions? I heard that you'd like the slide deck sent to you for input. I can do that before we leave today. I would ask, I think the easiest thing to do would be for you to write your comments on the slide decks and then just send those to me. Or you want to get them to me, we'll integrate them somehow. Okay? Steve, you have any party comments as the lead to this?
One piece I wanted to just, it's an old aphorism from the Army, and everybody hears these all the time, probably right, but we train to standard, not to time. And the reason we have pushed this is the criticality of what we're doing. We recognize it. Rushing to jump, rushing to just get something done makes no sense. This is the trustees, this is your strategic plan that we execute, and it's that critical. So it has been pushed to allow us the proper amount of time, and ultimately at the end of the day, we have to get it right. We understand that, and it is not a time-based, within reason, obviously, but it is not a time-based, it has to be done by X, Y, or Z. The intent is to have everything complete by the 30th of this month for presentation on the 3rd for the next planning and oversight. However, if you look at this and you say, this is absolutely not what we want, not what we're going to do, this does not make sense, then it gets moved. Because ultimately, at the end of the day, it is
the standard of what this organization and what our trustees want and need for the residents of this county. I'll get off my soapbox, but I mean, that's what I've got. Yes, ma'am.
Just a quick question. Given the, and maybe this can be held up by question, but given the fluidity of everything around us and the inability of us to predict what next month will hold and the necessity to be able to pivot depending on what we're presented with. I mean, how do we do it with this kind of specificity and, I mean, and this short time frame? My concern is we get to the end of that time and then we've got a whole different world. Back at square one.
I think,
I can weigh in a little bit, because that was part of our conversation with the staff and is obviously a part of what we put forward in the retreat. If you look at the detail of what is being measured, a lot of it is about enabling the organization to take a responsive posture. And what I mean by that is, and you may not know this about me, I led Ohio statewide coalition to expand Medicaid. So I'm very familiar with what the consequences are of some of the policy changes at the statewide level. And what I would say is, baked throughout all of these items is very much a what I would recommend if you hire me to say how do we get ready for the end of Medicaid expansion. I would say focus in on internal processes, focus in on reporting dynamics, focus in on accessibility plan and community engagement, and get ready to manage that throughout your contracts and standardize your approach, your contracting posture with providers, and create opportunities to regularly connect. That is much more about what's specific in here than saying thou shalt serve X amount of people. It's really just saying we need to measure the impact so that we can make informed decisions moving forward. So really this is, to me, what is reflected here is an orientation towards standardized communication, which is what people need when they're uncertain. They need to be able to trust the board and the information from the board is accurate and actionable. And then secondarily, that you all are empowered so you feel like you have an accurate understanding of what that need is, where it's not being met, and where you may need to make decisions around limited resources.
David, you were gonna say something.
couple of things. I think Nima has done a good job of helping me at least focus. To me, the most important thing you need to do is figure out how we're gonna make decisions. And what the process is gonna be. And to some extent, that's what he was just talking about. But I have a concern. There's another aphorism, Steve, which is if you have more than 3 priorities, you're not gonna get them all done. And I think there's too much stuffed in this. I think we ought to focus on, to me, the 3 main things that come out of this are the community accessibility plan, the benefit package, and how we're gonna make decisions and be flexible, making changes as we're presented with changing circumstances. And
David, can I clarify, does that translate into the service definition of priority populations? And services?
yeah, that's what I think of as the community accessibility plan and the benefit package. That maybe I'm wrong, but I think that's what it's all about. And that to me ought to be our focus. But I'm one person.
I think the communication where that comes in is important because the community is gonna start to get upset. They're gonna wanna know why we're not providing this and that and that. So if we have this communication, plan, it helps us communicate to people so they know what's happening. Otherwise, all they know is what they read on the internet. Just half of them don't read the paper or watch news.
What their neighbor tells them.
Yeah. Okay, that's it.
open session.
We'll move to open session then. Mr. Allen?
10 the 5:30 PM organizational meeting of City Council on Friday night. Half an hour after the meeting started, they were still coming through the door. It was jam-packed, standing room only. They made their speeches both sitting at their chairs, and then after the meeting, they came out and stood at the podium, basically the same speeches again about the coming new year and their optimism and stuff. 11 o'clock this morning, county commissioners had their organizational meeting. I was the only one there other than county employees and the news media. Lisa Sobiecki was reelected for a second time as their president. In her speech, she did mention the possibility of property tax reform. The word catastrophic was used. The county commissioners are getting ready for a very lean year. Just came from a budget hearing over at City Council. This was the safety committee. They hear the municipal judges, the clerk of courts, the law department, the police, and the fire department. I was only able to stay for the one. The municipal judges, they really got hammered on domestic violence. They gave their presentation, and then the council members started in on them. Teresa Morris started out with someone in her district. She read his rap sheet, which was a mile long, and asked over and over and over, why wasn't he stopped? Why was he allowed? And Sarantu chimed in, and he said, by referral, he wants to see how these domestic violence cases are being disposed of, who the judges were, did they have mental health problems, did they have substance use, and why did people just keep getting let out and letting out. But this is what these meetings are for, so that when you come before City Council and ask them for more money, you will be told this is what we expect of you, and they are communicating that their constituents are not really happy with the whole legal process right now. I don't know about the rest of the meeting. I had to leave. I would imagine during the police budget, they're probably going to talk about the desperate need for a second armored vehicle. If you don't know, we have a Bearcat. It's 17 years old. It was purchased with Homeland Security funds. It's on its last legs. They tried in 24 to take a called an MRAP, mine-resistant ambush-protected vehicle from the federal government. It would have been free of charge. The only thing they would have been responsible for is routine maintenance and fuel. But even though this vehicle is supposed to withstand guns and bombs, there's no protection from Toledo City politics. City Council voted it down. So possibly tonight they'll ask for permission to purchase a Tesla. And this will be a backup vehicle for our Bearcat. And I did suggest to them, if you do purchase one, keep it in the garage, don't park it on the street. Might be a really, really bad idea. But yes, the police budget is there now. Strangely, the Blade was the only media there. This was a long, long meeting, so I'll find out more tomorrow. But City Council is definitely getting an earful right now. And just about every discussion of law enforcement involves what do we do with mental health, what do we do with substance abuse and all that. And just bear with me. We are coming up on the 5th anniversary of the death of Officer Brandon Stalker. If anybody doesn't remember this, the man that killed him, he was running around claiming to be both Jesus and God. He tried to burn down Rosary Cathedral, and on January the 18th of 21, he barricaded himself in a house, came out shooting, and shot Brandon Stalker. Let's just try and remember that sometimes for a mentally disturbed person, it's easier to get their hands on a gun than it is to get the treatment they need. And as clearly stated, his family tried unsuccessfully to get help for him. We can't let this happen again. 2 families lost a son there. The 18th will be the 5th anniversary, so let's not forget that. So thank you for listening.